Welcome to the Real Wellness Podcast. Pressures of this modern life and society often steer us towards unhealthy lifestyles, but wellness is a rare treasure hidden in a maze of daily challenges. In this podcast, we illuminate uncommon pathways to health and vitality, exploring cutting-edge ideas in regenerative, longevity, and performance medicine, all delivered in bite-sized segments of 10 minutes or less. I'm your host, Dr. Jamie Lewis, and today we're talking with Jera Lee, and we are talking about one of the most overlooked but foundational hormones in the body in both men and women, DHEA.
This podcast is brought to you by the Center for Regenerative and Performance Medicine located in the beautiful Pacific Northwest. Visit us online at www.c4rpm.com. Before we begin, a quick disclaimer. This podcast is for educational purposes only and is not intended as medical advice. As always, consult a qualified healthcare professional for any medical concerns or treatment.
DHEA, dehydroepiandrosterone, is produced primarily by the adrenal glands and acts as precursor hormone. It feeds into testosterone and estrogen production in both men and women.
That's what makes it so important. If DHEA is low, the body doesn't have raw material it needs to build downstream hormone, no matter how well everything else is functioning.
DHEA peaks in early adulthood, and then there's a steady decline, roughly 2 to 3% per year after age 30. By midlife, many patients, men included, are running on a fraction of their youthful levels.
In women, low DHEA often shows up as fatigue, low mood, anxiety, brain fog, low libido, vaginal dryness, thinning skin, and joint pain.
And we frequently see it during perimenopausal, menopausal, or after a oophorectomy, but also in younger women with chronic stress or autoimmune diseases.
What's tricky is that estrogen and progesterone may look okay, but symptoms persist because DHEA was never addressed.
Now let's talk about men, because that's where DHEA is really underrecognized.
Absolutely. In men, low DHEA often presents as low energy, reduced motivation, poor recovery from exercise, brain fog, increased inflammation, and loss of lean muscle mass.
Here's the key point. A man can have normal total testosterone, but still feel terrible if DHEA is low.
We see this all the time, especially in men with chronic stress, metabolic syndrome, insulin resistance, or long-term inflammation. The adrenals are depleted and DHEA quietly drops.
Low DHEA in men is also associated with reduced immune resilience, higher cardiovascular risk, poorer stress tolerance, and accelerated aging.
For both sexes, DHEA plays a role in maintaining lean muscle mass, bone density, and metabolic health.
Which is critical because muscle is medicine. Low DHEA often correlates with sarcopenia, fat gain, and declining insulin sensitivity.
That's why in men trying to lose weight, build muscle, or improve performance, ignoring DHEA can stall progress, even if they're lifting and eating well.
Clinically, we measure DHEAS, which gives us a stable, reliable marker of adrenal androgen production.
And it's part of our standard hormone evaluation for both women and men, along with vitamin D, insulin, and sex hormones.
We never interpret DHEA in isolation. Hormones work as a system, not as silos.
When replacement is appropriate, we start low and individualized. For women, dosing often starts around 5 milligrams daily, sometimes titrating up cautiously.
And for men, dosing is often starting around 25 milligrams, depending on the labs and symptoms, and whether they're on testosterone therapy.
And that's an important point. Men on testosterone replacement can still have low DHEA. Testosterone does not fix adrenal depletion.
Signs of excess DHEA include acne, oily skin, irritability, hair changes. Those mean the dose may be too high. From a longevity perspective, DHEA is associated with better immune function, reduced inflammation, cognitive health, and overall resilience.
It's not about anti-aging in a cosmetic sense. It's about aging well, maintaining strength, mental clarity, and stress tolerance over time. If you're a woman or a man in your 40s, 50s, or beyond, and you're tired, inflamed, losing muscle, or just not feeling like yourself, DHEA should be evaluated.
Hormone optimization isn't about chasing use. It's about restoring the foundational physiology that allows your body to heal, adapt, and perform. Thank you for joining us today on the Rare Wellness Podcast. If you found value in today's episode or learned something new, please subscribe, leave a review, and share this podcast with a friend. Your support helps us to continue to provide free content to empower you on your journey to better health. This is Dr. Jamie Lewis reminding you that your body holds an incredible ability to perform, heal, and thrive. Sometimes it just needs the right tools to unlock its full potential. We'll see you next time.